Mastering panic disorder, understanding, coping, and thriving. In today's fast-paced world, it's not uncommon for individuals to experience occasional bouts of anxiety and stress. However, for some people, these feelings can escalate into something far more debilitating: panic disorder. This debilitating condition affects millions of individuals worldwide, and it's crucial to gain a comprehensive understanding of it. If you or someone you know is seeking further guidance on managing panic disorder, consider exploring our comprehensive course on the subject. Origins of panic disorder. Panic disorder is a complex and often misunderstood mental health condition. To truly grasp its nature, it's essential to explore its origins. Panic disorder typically emerges during early adulthood, although it can develop at any age. Several factors contribute to its onset. Genetic predisposition. Research suggests that genetics play a significant role in the development of panic disorder. Individuals with a family history of anxiety disorders are more likely to experience panic attacks. Brain chemistry. An imbalance in neurotransmitters such as serotonin and norepinephrine can lead to heightened anxiety and panic attacks. These chemicals regulate mood and stress responses, and their disruption can trigger panic disorder. Stressful life events. Traumatic life events, such as the loss of a loved one or a major life change, can trigger panic disorder in susceptible individuals. These events can act as triggers for the condition. Medical conditions. Certain medical conditions, such as thyroid disorders and cardiovascular issues, can mimic the symptoms of panic disorder. It's crucial to rule out these conditions through medical evaluation. Classification of panic disorder. Panic disorder can manifest in various ways, making its classification a critical aspect of understanding the condition. There are three primary classifications. Panic attacks. These are the hallmark of panic disorder. Panic attacks are sudden, intense surges of fear or discomfort that peak within minutes. They often include physical symptoms such as a rapid heart rate, sweating, trembling, and a sense of impending doom. Panic disorder without agoraphobia. Individuals with this form of panic disorder experience recurrent panic attacks but do not develop agoraphobia. Agoraphobia is a fear of being in situations where escape might be challenging, such as crowded places. Panic disorder with agoraphobia. In this classification, individuals not only experience panic attacks but also develop agoraphobia as a result. They may avoid situations that they fear could trigger panic attacks, leading to social isolation and impaired quality of life. Early warning signs and risk assessment. Early detection of panic disorder is crucial for timely intervention and management. It's essential to be aware of the early warning signs and conduct a risk assessment. Early warning signs. Sudden, intense fear. Individuals may experience sudden, overwhelming fear or discomfort, often with no apparent trigger. Physical symptoms. These may include a rapid heartbeat, shortness of breath, dizziness, chest pain, and nausea. Avoidance behavior. People with panic disorder may start avoiding situations or places where they fear having a panic attack. Risk assessment. Family history. A family history of anxiety or panic disorders increases the risk. Stressful life events. Recent traumatic experiences or significant life changes can raise the risk. Personal health. Underlying medical conditions or imbalances in brain chemistry can contribute to the risk. Dangerous consequences of panic disorder. Panic disorder can have profound and sometimes dangerous consequences for those affected. It's not merely a fleeting sense of anxiety, it can significantly impact daily life and well-being. Here are some of the potential consequences. Impaired quality of life. Panic disorder can disrupt daily routines, social interactions, and work performance. Individuals may become reluctant to leave their homes or participate in activities they once enjoyed. Isolation. As panic disorder progresses, individuals may withdraw from social interactions due to the fear of experiencing panic attacks in public. This isolation can lead to feelings of loneliness and depression. Substance abuse. Some individuals with panic disorder turn to substances like alcohol or drugs as a way to cope with their anxiety. This can lead to addiction and further complicate their condition. Physical health issues. The constant stress and anxiety associated with panic disorder can have adverse effects on physical health. It can contribute to heart problems, gastrointestinal issues, and weakened immune function. Suicidal thoughts. In severe cases, panic disorder can lead to suicidal thoughts or actions. The overwhelming sense of fear and despair can become unbearable for some individuals. Case studies. Let's explore 5 real-life case studies to gain insight into the experiences of individuals with panic disorder. Case study, Emily J. Emily, a 27-year-old teacher, developed panic attacks after a traumatic car accident. These attacks left her anxious and fearful, especially while driving or in crowded places. She began avoiding these situations, which significantly impacted her daily life. With the support of a therapist, Emily gradually learned to cope with her panic attacks through cognitive behavioral therapy, CBT. She practiced exposure therapy to confront her fears and regain her confidence. Over time, Emily was able to resume her normal activities, including driving, without the overwhelming fear of panic attacks. Case study, Michael K. Michael, a 35-year-old executive, experienced panic disorder due to intense work-related stress. To cope, he turned to alcohol, which only exacerbated his condition. Realizing the negative impact of his coping mechanism, he sought professional help. Through therapy, Michael learned healthier strategies to manage stress, including mindfulness and relaxation techniques. He also received guidance on improving work-life balance. With time and commitment, Michael successfully overcame his reliance on alcohol and found healthier ways to cope with stress and anxiety. Success stories. Now, let's highlight 5 success stories of individuals who successfully managed their panic disorder. Success story, Mark J. Mark, a 40-year-old engineer, successfully managed his panic disorder through a combination of relaxation techniques and cognitive behavioral therapy. He learned how to recognize and challenge irrational thoughts that triggered panic attacks. Through therapy, Mark also developed relaxation strategies to stay calm during stressful situations. Today, he enjoys traveling and outdoor activities without the constant fear of panic attacks hindering his experiences. Success story, Sarah P. Sarah, a 29-year-old nurse, sought professional help and medication to control her panic attacks. With time and therapy, she regained her confidence and returned to her nursing career. Sarah's dedication to her treatment plan allowed her to overcome her panic disorder and continue pursuing her passion in healthcare. Learn how to manage panic disorder. Real-life examples. To further illustrate the profound impact of panic disorder, consider these additional real-life examples. John V. John, a 30-year-old graphic designer, began experiencing panic attacks after a particularly stressful period at work. These episodes were often triggered during meetings or social gatherings. As a result, John started avoiding these situations, fearing he would have an attack in front of others. This isolation strained his relationships with colleagues and friends. John's quality of life deteriorated as he withdrew from social and professional engagements. Fortunately, with the support of his family and a therapist, John gradually learned to manage his panic disorder. Through therapy, he gained tools to cope with anxiety and panic attacks. He also worked on gradually exposing himself to triggering situations, allowing him to regain his confidence and resume a more active and fulfilling social and professional life. Sarah C. Sarah, a 25-year-old college student, developed panic disorder after the sudden and tragic death of her mother. Her panic attacks became so severe that she dropped out of school and rarely left her apartment. In an attempt to numb her anxiety, she turned to alcohol, which only worsened her condition. Sarah's life spiraled into isolation and despair. Recognizing the seriousness of her situation, she sought help from a mental health professional who specialized in trauma and anxiety disorders. Through therapy and medication, Sarah learned to manage her panic attacks. It was a challenging journey, but with time, she regained the ability to leave her apartment, re-enrolled in college, and found healthier ways to cope with her grief and anxiety. If you'd like to explore more in-depth knowledge and strategies for managing panic disorder, don't hesitate to visit our comprehensive course on the subject. Conclusion. Panic disorder is a complex and challenging condition that affects individuals in various ways. By understanding its origins, classifications, early warning signs, and potential consequences, as well as learning from real-life case studies and success stories, we can better support those dealing with this condition. Seeking professional help and finding effective coping strategies are essential steps in managing panic disorder and improving the quality of life for those affected. If you or someone you know is grappling with panic disorder and seeking comprehensive guidance, we encourage you to explore our in-depth course on managing panic disorder. This course provides valuable insights, strategies, and support to help individuals regain control over their lives and find relief from the challenges posed by panic disorder. Remember, there is hope, and with the right knowledge and resources, individuals with panic disorder can embark on a journey towards a happier and healthier life. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, Get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.